Hello, my name is Kristen Doherty, and today I will be giving a presentation on radiation therapy as a profession. In today's presentation, we will be covering what a radiation therapist does, salary, work environment, job outlook, educational requirements and additional training, important qualities for a radiation therapist to have, as well as some regional data that's more specific to my state of South Carolina. Many of you may be wondering, what is it that a radiation therapist does? And while they complete many functions on their job, their main task is to give radiation therapy to cancer patients. Radiation therapists work as part of the oncology team or part of the cancer team. One of the first things that they will do with their patients is to use x-rays to determine the part of the body that the treatment will be administered to. Once that's been determined, they will use linear accelerators, or LINAC machines for short, to give the actual treatment to the patients. Afterwards, they'll monitor their patient to make sure that they're not having any adverse reactions or negative side effects to the treatment that they've been given. Now let's move on to the part that you're all really curious about. How much money do radiation therapists make? According to the 2014 Occupational Outlook Handbook, the median or middle salary for a radiation therapist was $80,090 a year. The lowest 10% of radiation therapists will make less than $53,590 a year, while the top 10% will make more than $118,180 a year. So at this point, you might be thinking, what does a radiation therapist go through to make that kind of money? Radiation therapists work in hospitals, outpatient treatment centers, and physicians' offices. So because of this, they normally work regularly scheduled full-time hours, which seems pretty ideal. But keep in mind that radiation therapists must be in really good physical condition because they're on their feet for long hours and they may need to lift or turn a patient to administer their treatment. In addition to that, radiation therapy can be pretty dangerous. And in order to limit themselves to the exposure to radiation therapists will normally stand in another room while the treatment is being given to the patient. So by this point, I'm sure a lot of you are contemplating becoming radiation therapists. Keep in mind, it's a very competitive job market. In 2014, there were only about 16,600 radiation therapists employed in the U.S. While the Occupational Outlook Handbook has predicted a 14% growth rate from 2014 to 2024, that would only result in about 2,300 new jobs. However, due to advances in medical technology, we may see a higher demand for them in the future. So next, let's get to, what do you have to do to become a radiation therapist? Radiation therapists will either have a 2-year associate's degree or a 4-year bachelor's degree. During college, they'll be required to take courses in human anatomy and physiology, physics, algebra, computer science, as well as research and methodology. In addition to their classroom studies, radiation therapists must also participate in clinical rotations, which is why it's not necessary for them to have any additional on-the-job training in order to complete their duties as a radiation therapist. As of 2014, there were 120 programs that were accredited by the ARRT, or the American Registration of Radiological Technicians. Once radiation therapists have gotten their degree, they still have to pass a written ARRT exam. Because radiation therapists work so closely with their patients, it's extremely important for them to have great interpersonal skills and a good bedside manner. Radiation therapists must also have strong technology skills and be detail-oriented. Making a mistake on a patient's treatment plan can have some really big repercussions. Earlier, we covered the radiation therapist job outlook for the United States. So now let's look more closely at my state of South Carolina. In 2014, there were 210 radiation therapists employed in our state. According to the Occupational Outlook Handbook's growth rate of 14%, that would still only result in about 29 more jobs in our state, for a total of 239 radiation therapists in South Carolina by 2024. In South Carolina, the median salary for a radiation therapist is $90,260 per year, or $43.39 per hour. So, in conclusion, becoming a radiation therapist can be achieved fairly quickly. However, be prepared for some stiff competition. But if you're lucky enough to become employed as a radiation therapist, you can expect a career that's very rewarding, both emotionally and financially.